In this video, we'll demonstrate donning and doffing of the PPE that's required to take care of a patient with known or suspected Ebola. A few important points to consider first. You'll need to do this with an observer that's trained in this procedure. You can't make any adjustments to the PPE once you've initiated patient care. And if at any time you notice a breach, exposed skin, or contamination, immediately remove yourself from the patient care area and notify your partner, who can begin corrective actions or decontamination. So let's get started. The first thing we're going to do is you're going to change out of your uniform and put scrubs on. With that, you should have nothing on your belt, remove any of your jewelry, but you'll need to use your shoes and socks. Okay, so Greg has got scrubs on, ready to put the gear on. The one thing I'll also mention is that you may see subtle variations in the actual equipment that we stock on the rigs, just as supplies change. Okay, so Greg's going to start by first putting on shoe covers. And some of these steps will make more sense as you see it being taken off in that process. This is followed by larger boot covers that go up to the mid-shin. And as you're doing this, you should be looking at the equipment, making sure there are no holes or defects in the equipment. All right, he's going to foam his hands, which will simulate so we don't have to wait for it to dry. And the observer can be kind of getting things ready as well, inspecting the suit, making sure there's no obvious tears in any of the seams. Okay, next step is the Tyvek suit. And go ahead and zip it up. And then at this time you would remove the adhesive cover here and tape the flap shut. I'm not going to do that for demonstration purposes. Tape the inner gloves. This too tight, and then you always want to leave a tab on the end so it's easy to remove. Again, that's the observer's job, is to make sure that everything is kind of sealed and tight. Next is the N95 mask. Again, the reason we're wearing N95s is for just better splash protection and better face seal, which you can see Greg just tested. So you want to put it on just like you normally would for an airborne problem. We're using it for better splash. And next is the hood. Now I'm going to want to make sure that nothing is folded wrong. Make sure things are completely covered down here. Okay. And next will be on the outer gloves. You want to make sure you're using a size bigger than the easier said than done. You want to make sure that they're completely covering that taped up seam and they're pulled all the way up. That's good. And the final step is the full face shield. And this is an important step for the observer to make sure that that suit is completely down underneath that shield. It commonly will be exposed right on the top part there. One final look to make sure that everything is in order, nothing got ripped or torn in the process of putting it on. And the final step is to sanitize the outer gloves before you initiate patient contact, just like we would wash our hands before we take care of a patient. And that concludes the donning portion. Next, we're going to put down a large plastic sheet. If you are using a chair, just have the chair right at the edge of the plastic. And then on top of this will be one of the large red biocontainment beds. And then whoever the provider was is going to basically be standing inside that bag, and everything we take off is going to be dropped right down into the bag. So the first thing we'll do is just inspect the suit and make sure there's not an obvious breach. Any obvious contamination, for example, if you want to demonstrate just wiping off, in particular by the zipper flap, because that's going to be opening to the clean surface. Okay, you want to kind of remind the provider, don't do anything reflex. If you notice something or feel something falling or dropping, let me know and I'll help you with it, is how you want to do that. All right, first thing to do is disinfect the outer gloves. And then you're going to want to open the zipper flap, being careful not to touch the zipper, the actual zipper itself, because that outer flap may be contaminated and the inner zipper is not. Okay, now disinfect your gloves again. And remove the outer gloves. You can see how Greg used that first glove to help him touch the second glove without contaminating anything. Now the provider can remove his own tape from the wrists. Kind of want to keep the observer as clean as we can for the most part. And just check to make sure there's no holes or tears in the gloves. And then, while leaning forward, he's going to remove his full face shield, touching the very back strap. Trying not to touch the front. Remember, those inner gloves are clean, so you want to touch clean surfaces, which is the back. Now, just in case, you disinfect the gloves again. And a similar process now with the hood. Touching the top and the back and dropping it down. Perfect. Disinfect your gloves again. And now with those clean gloves, you're going to unzip your suit. Now you can see that flap is closed again, so he's going to want to open the flap all the way. And I would disinfect the gloves again because that flap got opened and he had to touch that outside surface. Now unzip. Now the observer is going to assist in removing the suit by putting his hands in front at first, toward near the clavicles, touching only the inside of the suit, rolling it off the shoulders. Then get behind him, and then you're going to roll the suit off, touching only the inner surfaces. And take your time, do it slow, and watching every surface you touch. Now both will disinfect their gloves. And now we're going to start removing the boot covers. This is probably the most difficult part. You want to just take care that you're only touching the inside portion of the suit. And then that foot goes out onto the plastic sheet. As you can see here, he's only touching the inside surface of that boot cover and the inside surface of the suit. Perfect. Okay, now disinfect your gloves. And just like the face mask, now leaning forward over that bag with the back straps of the N95. I'm going to remove that without touching the front. Disinfect one more time. And now while at the edge of the plastic sheet, take one shoe cover off and step off the plastic. Followed by the last one. Now you're going to want to remove your gloves and perform normal hand hygiene with the alcohol-based foam. Remember, the wipes are for objects, foam is for skin. And the observer is going to want to perform one last check just to make sure there's no blood or any contamination, particularly on the back. Okay, now the observer closes the large biocontainment bag. The provider is going to need a second set of a clean set of gloves on now. So the provider has a clean set of gloves on and a second large biocontainment bag. So the observer now puts that first full bag with all the contaminant into the second bag. You want to keep holding that second bag. Disinfect the gloves. Now, while at the edge of the plastic takes one shoe cover off at a time, putting it in the bag and stepping off the plastic as that shoe cover is removed. Perfect. The observer cleans his gloves again. And finally, folding up the sheet of poly, placing it in the second large bag. You can see he's touching it just from the edge, from the bottom. Okay, so after the plastic is put in the large bag, then the observer is going to remove their PPE and place it in the bag. You'll notice he cleaned the inner gloves after taking off the outer gloves. Same technique, bending over, touching only the back. Theoretically, the observer is clean anyways. And just being careful not to touch the front of the mask when you do that. Okay. And tape. And one last hand sanitization. Any changes in equipment, policies, or procedures will be emailed as they occur.